Welcome to the Bladder Cancer Canada Podcast. I'm your host, Summer Stewart, volunteer with Bladder Cancer Canada. As the first and only Canadian patient advocacy organization dedicated to bladder cancer issues, Bladder Cancer Canada is proud to provide patients, their caregivers, and families with the support and resources they need to navigate a bladder cancer diagnosis. Through patient support, awareness, and research, our vision is to create a world where bladder cancer is just a memory. While Bladder Cancer Canada strives to support Canadians in their diagnosis and journey, we hope that anyone listening from around the world can benefit from these discussions and know we support you too. As a reminder, this podcast is for educational purposes only and is not intended for medical advice. If you need medical information, please speak to your physician. For this episode, we've invited bladder cancer survivor Stewart Press from Toronto to share his story. This is Stewart's story. Welcome, Stuart. I'm so happy to have you to the podcast, and thank you for sharing your story. I was hoping that first you could tell us a little bit about yourself and your background before you were diagnosed.
So I'm 30. I'm 30. I wish I was. I'm 61 years old. I'm self-employed. I have my own company. I'm married to the anchor of my life, Paula, for 36 years. I have two beautiful children and a lovely daughter-in-law, my son Ryan and his lovely wife Carly. Both live in Guelph. And my daughter, Kaylee, who's pretty much my mini-me, lives in Ottawa. So that's basically quick background.
Quick background, yes. So maybe you could explain to us, what were the first signs and symptoms, and what led you to seek medical attention and eventually discover your bladder cancer?
So not going too far back, basically a year before I was officially diagnosed, I had been diagnosed with a diverticulum in my bladder that my urologist had diagnosed. I'm on blood thinners from various DVTs. So I had some blood in my urine at that time, nothing that was worrisome for even thinking about cancer. It was diverticulum that they felt that could eventually have some complications in my bladder, not cancerous, but other complications. So that was removed. All was fine. I had some complications post-surgery, but everything was good. Went on with life. And then almost a year to the date after my diverticulum surgery, I was on a business trip in California, getting ready to go out for some meetings. And basically, I noticed that there was some blood in my urine. I was peeing blood, so I was filling up little cups of blood. My wife called my urologist's office, spoke to the assistant. I was in the hospital a day after I returned back to Canada. The news from the test results at that point, after various test results confirmed cancer cells consistent with bladder cancer. And that was basically how I discovered bladder cancer and the signs.
Wow, that must have been really scary to see that blood in your urine.
Certainly frightening. Never in a million years would have thought that, I would have been diagnosed with cancer, let alone bladder cancer. It's one of those untalked about cancers. It's not well documented. And, unless you're actually going through it and know someone who's going through it, it's not one of those major top three that people talk about.
Well, we're changing that here today.
Certainly.
So maybe you can kind of describe what was the difference between your diverticulum blood versus the bladder cancer blood? How did it look different? How did that differ?
The blood year before the diagnosis was it was a diverticulum in my bladder, and I guess from the way it was explained, and I'll try to recall as best as I could because it's over 3 years now, was that the blood, because I was on blood thinners, could end up staying inside the bladder wall, and because of the way the bladder is situated in the body, very difficult for that stale blood to drain out. So it wasn't the same type of blood as when you actually pee blood. It wasn't like a dark red type of a blood that's quite dangerous and worrisome.
So when you say dark red blood, that was what you were seeing with your bladder cancer. What was diagnosed as bladder cancer, correct?
Yeah, it was a brighter red.
Okay, all right, interesting. And how did you take the news of that diagnosis?
Well, my urologist called me on the phone. I was in my office at the time. The news was utter shock and disbelief. It's not news that I would have ever expected from the phone call. I felt, the blood run out of my entire body. pretty much. I immediately left my office to go home, tell my wife the news as best as I could. And there was just dead silence. It was just dead silence. Cancer was something that my wife has always been fearful for, that C word, so it was just utter disbelief.
And do you have a family history of cancer?
Well, I do not, other than, just, both my parents had things removed that were possible turning into cancers for melanoma, but nothing of that nature. My grandfather had melanoma, but not really anything like that, but not a real prominent history of any cancer in the family.
So it was more melanoma that was more on your radar than, say, like a urological cancer. That's for
100% that we would get checked from from dermatologists annually. I mean, make sure that we're, wearing sunscreen and hats and not too much sun. So that was sort of any type of worrisome, but nothing that I would think was internal.
Walk us through your treatment journey. So you've been diagnosed by your urologist. You've shared with your wife your diagnosis. And what happens next?
So basically, I was officially diagnosed in early October of 2021, during one of the darkest times of modern history, COVID. Our support system was basically torn away from us. Gatherings were limited. My kids live out of town. Like I mentioned, one in Guelph, one in Ottawa. At that point, there was really no one to turn to, very few people to speak to. Support system was at minimal at best. Doctors were very tough to reach. My wife turned to the only doctor that's 24/7, which is Dr. Google, which is never a good thing at best of times. I asked my urologist to refer me to Princess Margaret after we discussed the diagnosis, being in Toronto and them being one of the top probably 3 to 5 hospitals in the world for cancer. I felt that would be remorse if I didn't get a second opinion. And even not a second opinion, I trusted my urologist's diagnosis, but I wanted to, if I'm going to do treatment, I certainly want to go to a place that specializes in that type of treatment and only deals with that treatment, which is cancer. I was able to get an appointment with the doctor at Princess Margaret in January of 2022. So a slight wait from October to January. And met with who eventually would be, my savior, a lifelong hero, as well as a friend in this fight to help others and eventually find a cure. And that's someone who's very well known to Bladder Cancer Canada, Dr. Girish Kulkarni. I admire him, I respect him, and he was the one who basically ended up dealing with me throughout my care. We discussed various options. There is a numerous amount of options for patients that are diagnosed with bladder cancer. The one option was BCG. The second was clinical trial BCG that was ongoing, and that's like BCG on steroids. It was something that was a clinical trial. The third one was a neobladder, which I was considering at the time, but didn't like the possibility of having to self-catheterize if I wasn't able to void. That's a possibility. With the neobladder, it's another way of bladder preservation. And the fourth one was the radical cystectomy, which is bladder removal, which is what I chose. Since bladder cancer has a very high rate of reoccurrence, I believe up to 80% reoccurrence in bladder cancer, I wasn't prepared to roll the dice at such a young age. And I chose the most radical one, certainly a little bit of life-changing at the beginning, but that's the one that I chose. And since it was COVID, getting surgery was very, very challenging. It took over 7 months from the time I was diagnosed back in October to actually get surgery. I was able to start chemotherapy prior to surgery. I was only able to tolerate one treatment of chemotherapy. You have to go through blood tests and blood counts before each chemotherapy treatment. They check your kidneys, and my blood counts and kidneys didn't meet the requirements after 2 different weeks of testing. I discontinued the chemotherapy treatment, which was also devastating because you hope that chemotherapy while you're waiting for surgery is at least some form of treatment. I was finally able to get surgery in April 2022, April 7th. We were talking about doing the surgery robotically, which is very rare. There's only, I think, one robot in the entire hospital system for Princess Margaret. He was able to secure the surgical suite and the robot. It was a 13-hour surgery
Wow.
done fully robotically. He wasn't certain, and he told me that there may be a risk that they would have to abort the robotic surgery because of the diverticulum surgery that I had a year before. They were afraid of scar tissues where the robot wouldn't be able to get the bladder removed. But thankfully, they were able to do the entire surgery, 13 hours of it robotically. And, my daughter ended up coming in from Ottawa to support my wife while I was in surgery for the 13 hours, as well as in the hospital for 7 days post-surgery.
So you opted to have your bladder removed and chemotherapy. So you didn't have any other types of treatment then?
No, other than just TURPs and scrapings and treatments that were done after my diverticulum and while I was waiting for the surgery, just
Wow.
trying to scrape out whatever cells there were.
How did the choice of treatment affect your daily life and overall well-being?
Basically, daily life and well-being, given the circumstances, I was very positive. The only way to battle this disease and probably any disease and news is to remain mentally positive. I'm a firm believer that your mind will kill you way before the disease will kill you, and that's what I felt, and that's what I believed throughout the entire time. You have to keep active. You have to stay positive. What I found out and what I believe now, and my wife is coming around to believing it, is cancer is not always a death sentence. Survival rates are much higher in those who catch the disease in the early stages. Early diagnosis is key, which is why I'm a huge advocate of keeping up on medical checkups, blood work, diet, exercise. I mean, again, early detection saves lives. The biggest challenge was keeping my wife positive and sane during the whole time. With such a long wait for surgery, it seemed like a lifetime. I mean, even though 7 months to most people doesn't seem like a long time, but 7 months during COVID. And all I can keep thinking of is at the time I'm 59 years old, which is very young to be diagnosed with bladder cancer. This type of disease typically strikes people in their older years, especially males. And I was young. And I was thinking that my survival was imminent on getting surgery as soon as possible, removing my bladder and removing the cancer inside. And all I can think of is that the cancer kept spreading inside me. That's all I was thinking of while trying to remain positive.
That can't be easy. How did you deal with the psychological aspect of the waiting for 7 months?
Again, wasn't easy because the support and everything was shut down. So it's not like you can go to bars and to restaurants and to movies and keep yourself busy. The most difficult part was sitting at home and waiting and trying to remain busy. And on top of that, hearing the bad news that was going around at the time. All you would turn on the TV and hear of, more people dying from COVID, more things being shut down, then being open. So it was difficult, but again, it was the mental thing that you had to play with yourself. And I just said, I'm just going to beat this and fight it and just carry on. And, there wasn't really an option other than to remain positive.
Yes, I know that positive attitude makes such a huge difference in the outlook in a cancer patient's treatment journey and their overall well-being. I think that positive attitude, great support system really does make a difference.
100%.
So what types of lifestyle changes did you make as a result of your bladder cancer diagnosis?
So the only lifestyle change I made was my thoughts on life. That was one of the major changes I made. What was important to me prior to being diagnosed was much lower on my list than what really matters in life. Every day I wake up, I can be with family and enjoying life is a blessing. Even though I get hot and bothered quite easily and, sometimes go off the rails for certain things that, that mattered to me before don't matter anymore. I mean, you have a total different outlook. When to me, I look at it as I've been given a second chance, and I don't take that lightly.
Yeah, no kidding. Did you experience any side effects from the bladder removal, the chemotherapy, and how did you cope with those side effects?
So again, the side effects of chemotherapy are huge. I didn't have a chance to go through the full side effects because I wasn't able to go through the full 6 weeks or whatever it would have been of chemotherapy. Can't really say I had a lot of side effects from the surgery. Recovery, because it was robotically, was a lot easier. The incision is a lot smaller, so the recovery was easier. I did have to leave the hospital post-surgery with some apparatus inside me, which was a Jackson Pratt that had to stay in my, it's an external tube that they use for drainage of toxins in your body.
Okay.
And that should be removed post-surgery, usually before you leave the hospital. Mine, because it wasn't draining, they weren't draining the toxins at the proper rate, had to stay inside me for 2-3 weeks post-surgery, and they sent me home with it. And I had a nurse come to my house a couple times a week and just check it. And myself and my wife, we drained it and kept the counts of how much was draining, because that was an important thing. But that was the only real side effect in coping.
So coping with a cancer diagnosis and treatments can be very overwhelming. What strategies or coping mechanisms did you find most helpful during your journey?
So, like I said, keeping positive no matter what's happening was number one. Keeping active and telling yourself that you want to live and you can beat this every day was key. Thinking of the reasons why you want to live and why you want to carry on, especially when you're younger. My lifelong mantra, which I ended up getting tattooed on my arm after my surgery, which I live by every day and have lived by even before the diagnosis, was failure is not an option.
I love that.
And that's now part of me. It's always been part of me mentally, but now it's part of me physically. It's on me. So that's really, what was the coping mechanism. Is, to me, there was no other option. Failure wasn't one of those options.
The role of the healthcare provider is crucial in the cancer journey. How would you describe your interactions with your medical team, and what made those interactions positive or challenging? You had mentioned having Dr. Kulkarni as your urologist. Was there any other medical team that you wanted to kind of touch on?
100%. My medical team were very supportive and helpful every step of the way. And yes, I agree. Choosing the right doctor and the right hospital, to me, is key. My urologist, Dr. Kogan from Mackenzie Health, and his assistant, Angie, were unbelievable during my year before diagnosis, with my numerous treatments and surgeries and so forth that were non-related to the cancer, because they had nothing to do with my cancer treatment, but my urology treatments before that. They were unbelievable, and I credit Dr. Kogan for really saving my life and catching these issues. Dr. Carney and his assistant Kira were simply magical throughout the process. Even though it was COVID, I mean, Kira would respond instantly, keep me positive, and say, "Hang in. We're trying our best to get you in. It's very difficult." Dr. Carney is only getting a few hours a week of surgical room, and when you need 13 hours of that, only a couple hours, it's like, and she says there's a few people like you in the same situation, and it doesn't make your life easier, but, it definitely helps you remain positive. I could never thank them or repay them, which is why I continue to work and support Bladder Cancer Canada. My stoma nurse at the time, I never even heard the word stoma or knew what a stoma was prior to bladder cancer. Deborah Johnson and the team at Princess Margaret and Toronto General were fantastic. They never get enough credit, and they certainly don't get credit, and got very little credit throughout the pandemic, like most first responders and healthcare people didn't. And these are people that I could not thank. There's nothing that I could do to thank them. Nothing.
Yeah, we're extremely lucky in Canada to have such wonderful healthcare workers, between the doctors, the nurses, the support staff.
That makes life easier. I mean, again, the medical team and the hospital that you choose makes a big difference.
Absolutely. Often patients find support in online communities or local groups. Did you connect with other bladder cancer patients or survivors? And if so, how did that support network help you?
Yes, I reached out to Bladder Cancer Canada. I spoke to a few patients, which were extremely supportive and helpful. I spoke to patients on both sides of the spectrums. One that had gone through the one that had gone through the bladder preservation, and one that went through, like I did, bladder removal. And it was helpful to go through, the explaining what to expect. And I ended up, my wife ended up through searching online, somebody out of Montreal who's also big on bladder cancer and has lived now probably better part of 20 some odd years without a bladder. Does conferences and everything, and I was able to watch that, and it was supportive. So it's very important to actually hear from people who have gone through it. You could never say to someone, I can imagine what you're going through. You can't imagine what someone's going through unless you're actually going through it, which is what made me decide to now devote my time in helping others, because I can actually be a first person to them that's actually been there, done that, and tell them, I can't give them advice on what to do, but I can tell them what I've gone through. And it's very important, for people that have gone through, any type of disease or surgery, to give back and support, because they can help patients that are going through it with firsthand experience.
How did you find Bladder Cancer Canada?
How did I find them? I believe it was probably just an online search. I can't remember if there, I know there's now I'm more alert, and I see pamphlets in doctors' offices, in my family doctor's office, there's pamphlets. But like I said earlier, there's not enough resources for this type of cancer. It's not high on the radar for government. It's certainly not well funded at all. And these surgeries, from what I understand, are some of the most expensive surgeries in cancer treatment. So I really believe that the government and really has to step up and take a stance and make it more aware. Awareness is key. There's not a lot of awareness. Certainly there's, Bladder Cancer Canada, and there's the walk for bladder cancer. But when I look at the walk for bladder cancer compared to the run for cancers and other things, I mean, it's like, for me, it's like a gathering of friends compared to what other cancers are. And I think it's really important for the government and medical to realize that this is something that they need to inject money in. I mean, again, research is important, treatment is important, early detection is important, post-surgery support is important. And these are all things that are coming along through Bladder Cancer Canada, but I think we're still a long ways away from getting to where we need to be.
No, I completely agree. There isn't enough awareness around bladder cancer. Like you said, there's lots of events happening for breast cancer. There's a lot of different cancers that get a lot of publicity, and bladder cancer, unfortunately, isn't one of them. And that's what we're doing today. And by these podcasts and interviews is starting to raise that awareness and start the discussion. So looking back, what would you have done differently, if anything?
I don't believe in living in the past. I never had and never will. We can't change the past. What I believe, we can only shape the future, is my belief. I believe in going with your instinct, as you're the only one who ultimately has to live with your decisions. So there's nothing that I would do differently, nothing that I would change. There's really no wrong answers. The only wrong answer is doing nothing and not keeping up with your health. If you see something isn't going right in your body, it's probably isn't. A lot of people push aside things and say, it's probably, just, a simple headache. I know when I was diagnosed with my blood clot, it was a pain in my back of my calf. I went to my family doctor, and she says it's probably just a muscle. Everything now is just muscular, right? And, fortunately, she says, just go to the hospital for an ultrasound. And certainly I didn't leave the hospital that day. I was diagnosed with a blood clot. Well, luckily, it was something that I didn't take lightly. My doctor sent me to the hospital. So I think, if you feel something with your body isn't going right, it's important to get it checked out. I mean, better to be safe than sorry. Better to get a positive diagnosis that it was nothing, which is the best confirmation. Early detection is key to survival. I mentioned before. I wish I can drive this message home to our medical professionals and government officials who are allowing many people to unfortunately die due to red tape on screening timelines. I think the government is not realizing that younger people these days, cancers, all form of cancers, are being diagnosed in much younger patients than they were ever before. And that's based on lifestyles. It's based on living conditions. There's so many factors that it's based on that I think the government has to actually wake up and understand that you can't have, women going for mammograms at a certain age. You can't have people going for colonoscopies at a certain age just because that was the norm 25, 30 years ago. Patients are getting diagnosed younger and younger and younger. And if they were able to get screened and tested, and these tests aren't that much money in the grand scheme of things, where if they were getting tested, we could save lives.
Absolutely. How much is a human life worth, right?
Well, exactly. A lot of these cancers, breast cancer, colon cancer, prostate cancer, which are the top three prominent ones, early detection is almost at a 90 plus survival rate. My numbers could be off, but even that's a high rate of survival from early testing and diagnosing.
And do you think maybe that's because of the awareness and the education that's gone into educating the public about early detection in these cancers versus other ones?
I think there's just not enough importance put on early detection.
Yeah.
And I think the resources, unfortunately, are so limited. We all know in Canada, there's not enough doctors. There's not enough family doctors. But I think, what the government needs to do, is we're not going to get into other areas where they spend their money and resources. They really need to focus on these important issues, which is early detection, awareness, screening. These are all things that could save lives. And they have to step up and cut the red tape and allow people those resources, especially ones who want them. There are people that don't want resources and they don't care about having a doctor and they don't care about going to them for medical checkups, but the ones who do want them should be able to get them.
Absolutely. And then on the flip side, patients taking the time to actually go to the doctor and look at what's happening with their bodies, and they're seeing things, symptoms and signs, and really kind of taking the time to go see a doctor too on the flip side, because like you said, a lot of people will just assume that it's a headache. Next week it will go away. After some time, it can get up to 3 months, 6 months very, very quickly, right? So I think that, like you said, early detection is key from a physician and government standpoint, but also from the patient standpoint as well. You have to take control of your own health.
Oh, 100%. That you have to be your own advocate in the medical system here in Canada and probably around most parts of the world. You have to be your own advocate.
Absolutely.
For healthcare. You have to push yourself to get checked. Obviously physically, you have to push yourself to go to the doctor, and then you have to fight for what you need to get done.
Is there a takeaway that you would want new patients to know who are just starting their journey?
For patients that are just starting their journey, again, talk to as many people that are in the know that can give you positive light. Bladder Cancer Canada is certainly one of the best resources. They're utilizing people like myself that have been through it and willing to take the time to give you advice. I mean, anytime I get an email from Teresa and her team and saying, "Hey, look, I've got another case here. Can you take it?" I mean, there's not enough time in the day that I wouldn't spend talking to patients. They say, "Is it okay if my wife or my sister or my brother are on the phone?" And bring everybody in. It's important. I mean, the support group is important. Your entire support group of people that are going to be living with you, because it's not only the patient. And what people don't realize is it's I'm a firm believer to this day. I think my wife had a harder time than I did, even though I was the patient. It's easy to get rolled into the surgery room. They put you out, and you lie there. But think about your family who had to actually have to sit there at home waiting 15 hours to hear from a doctor. What's happened. I mean, there's no guarantees when you go into surgery. Forget about the outcome of the surgery, of you're even going to wake up from the surgery. So it's important to bring your support group that wants to be part of your group, bring them into it, let them get as much information as they can. It's important, for them to understand processes and procedures and what's going to happen. And like I said, when I'm speaking to patients or people diagnosed, there's nothing off the table. There's nothing that I won't discuss with them. This isn't an issue where it's, private. For a long time, my wife really wanted to keep it private. And, I felt personally that this isn't something that should remain bottled up. I think it's important. In order to help others, you have to be forthcoming.
That's wonderful, Stuart. Well, the bladder cancer community is definitely lucky to have you. And Bladder Cancer Canada thanks you so much for your time today, sharing your insights into your diagnosis and treatment and your kind of state of mind and how you stayed positive through it all. This will be very beneficial, I think, for patients who are just starting their journey, who are mid-journey, patients who are even facing, re-diagnosis, retesting, and some of those fears that come up. And I think that you're right. I think the more that we talk about it, nothing's taboo, nothing's private. The more that we talk about it, the more comfortable everybody becomes. And then that's where the awareness is raised, right? I think that
100%.
These discussions are long overdue, and I agree with you. They need to be kind of put out in the open.
Yeah, I think the lid on the bottle, from my standpoint, has been taken off. I'm happy, like I told that one of the former chairs and the founder of Bladder Cancer Canada, when I told him when I see him at the walk every year, that I will speak to anybody and everybody that I can. Realistically, I've slowed down my personal business life to be able to devote as much time as I can to this. It's something that I feel is more important. Also, on other positive aspects of things to share with people is that, I had my surgery in April of 22, in April of 2022, and in June of 2022, I was actually traveling again on business with my wife and daughter and swimming in Arizona.
Wow.
So life doesn't stop post-surgery. Since my surgery, I've traveled many times around the world overseas. As far as Thailand, and sat on a plane, and life goes on. You basically find ways to do these things. I'm active. I play pickleball 3 to 5 times a week. So I continue my life as it was before, if not better. So it's not, people say it's life changing. There are certain things that will change in your life, but again, it's all basically how you handle it mentally. With the support of my family, my life's gone on, and I enjoy the time and appreciate it more after my diagnosis and surgery than before.
Well, thank you, Stuart, for speaking to me today and volunteering your time to Bladder Cancer Canada to help patients. It's not just Canadian patients. There'll be patients listening from all around the world. And we support all bladder cancer patients with this podcast. So thank you so much, Stuart, for taking the time to speak with me today. It was really nice meeting you and wonderful hearing your story. And I wish you all the success and health in the future.
Well, same to you. It was a pleasure meeting you. Unfortunately, under these circumstances. And, all I can tell your audience is, like I said earlier, failure is not an option.
Wonderful advice, Stuart. Thank you so much.
Have a good rest of the summer.
Yeah, you too.
All right. Take care.
This concludes Stuart's story. If you or someone you know has been diagnosed with bladder cancer, Bladder Cancer Canada is here to help with support programs, informative resources, and educational sessions. Visit us at bladdercancercanada.org to access these resources and to share your story. Be sure to follow us on X, Facebook, Instagram, and YouTube. We will respond to messages sent on socials. If you are a bladder cancer patient or survivor and would like to share your story on the podcast, please contact us at info@bladdercancercanada.org.